Hello and welcome to Leaders of Tomorrow, India's largest platform for entrepreneurs. Anything that matters to you, we've got it covered right here on the show. Today, in our continuing focus on healthcare, we're doing a special all of this week. We're focusing on what India's best known experts are saying about how they prepared for the tsunami of the pandemic at a time when no one knew what was going to hit us. All of that and more being posed to this panel. Let me quickly introduce them. First up, Dr. Alok Roy, Chair, FICCI Health Services Committee, Chairman, Medica Group of Hospitals, Dr. Prashanth Rajagopalan, Director, MGM Healthcare, Dr. Peters, Director, Max Hospital. Gentlemen, doctors, thank you so much for taking the time to join us here on the Leaders of Tomorrow. And on behalf of all of us, I just want to first off thank you for the service that you're doing for the country in what has been, in all of our living histories at least, one of the most difficult and unimaginable situations we could have ever found ourselves in, God willing. We are at the end of it and we are able to emerge from this stronger. But yes, thank you once again to everyone who's in the healthcare and in the medical facility for everything that you're doing. I want to start by talking about what 2020 was like. You know, the pandemic is not something anyone could have prepared for. What was like that for you personally and professionally when the pandemic hit? What was the rest of the year like? It's open to all three of you on this panel as opening comments, but Dr. Roy, maybe I could come to you first.
Thank you for inviting us for this discussion. If we start with the last year we got hit by something which we had never seen, never heard, had no knowledge, and never saw it coming. It's suddenly all over us, and we had to manage it without knowing anything about it. We were not equipped, we were not trained, hospitals were not ready technically, but then the entire country went on lockdown for the first couple of months. That gave us some time to breathe, to gather our wits, our nerves, pick up some instruments, some knowledge, and we started engaging with it. And we did whatever we could, and country came out rather easily as compared to, we can say easily as compared to last time when you compare this time. If the last time was a goat, this time is a Godzilla. It's a far bigger, far
Yeah.
unpredictable, far more dangerous, far more people are dying, far more people are suffering, and there are enough kind of unrest in the entire country.
Yes, I 100% agree with Dr. Roy, and he's given a very good example for Godzilla. And it's like I stay in Delhi. We have no sea, we've got no seashore, we got no bay. It's like a tsunami coming and hitting us. We don't know from where it came, why it came, how it came. We have no drainage system. We do not know what to do with so much of water, and we knew nothing about the tsunami. Like people were living on the shore, probably they know what a tsunami looks like. We have no clue. The virus was new. It really came as a sudden surprise. We had no knowledge of the virus, no knowledge of how to tackle the virus, but we still did well. I won't say we did bad. We did well in terms of curtailing the virus and curtailing the death rates. But yeah, in terms of professionally, me being a surgeon, surgery became almost zero, and we were only doing emergency cases.
Dr. Rajgopalan, very grave terms really being used to describe what has definitely been a very grave situation. For you, 2020, personally, professionally, how did you prepare for a situation that nobody had any idea about? And yet, experts like yourself were at the front line being expected to respond proactively to what was really going on around us.
I echo the sentiments of both the panelists here. I mean, there was no way we could have been proactively prepared for what we saw last year. Last year, it became quite evident that we had to deal with what was thrown at us with very little armament. We had to fight the battle while we were definitely not ready for it. And I think we did a pretty good job at that. And this year around, I think we have enough understanding of how the disease progression is and how COVID works. Except, I think the entire country was caught unaware at the quantum at which it would hit us back with the second wave.
One thing that could get fixed in urban India, what was that according to the three of you? Open to all three of you.
We come from a healthcare system which has international accreditations, domestic accreditations, and the best patient safety protocols and mechanisms. We run a lot of fire drill, so we prepare for worst case scenario. We actually, conduct mock drills to see how we are prepared. But I don't think any hospital or healthcare system has done a pandemic ready drill.
Small cities don't have a critical care beds at all. When they talk about critical care beds, what they do is that they put one AC. That's the biggest representation of critical care bed in smaller towns. And bigger towns had a abysmally low number of critical care beds as compared to their overall number of beds. And in government, the critical care beds are pathetically low, and training for using the some of the equipments are even lower. Like government is saddled with hundreds of ventilators and BiPAP and CWAP and IV machine, which they have not even opened. So the biggest and glaring example of lack of ability to implement critical care, which this pandemic got the gap and opened the seam and made it a whole wide road and entered and destroyed our youngsters, our old people.
Sure. Uh, Critical care policy, Dr. Peters, what do you want to add to that?
So I'll just say one thing: modern medicine basically is based on statistics and reports and studies. If the world was having a second and a third wave, right? Why won't we have it? So we just put it behind us and saying that probably we won before we actually won. Number one fault. Number two, as Dr. I clearly said, we did not prepare for it. At this point of time, I'm seeing more death because of lack of infrastructure support than really the disease itself. So there's a lack of real infrastructure support. No oxygen in a country like this, where we are sending our vehicles and our astronauts to look for water at Mars. We don't even have water for common man. We don't have oxygen for common person. So it's a total failure of probably foreseeing and a foresight wherein we are going to need it. If Spain needed, France needed, US needed it, we would need it too, right? So some amount of lack of policy, lack of foresight, and lack of infrastructure support we could have done. Thirdly, we know if we can, our GDP of healthcare is very less. So probably in future, if we can actually allocate more money to healthcare than really other projects, right? So it's good to have money flowing in other projects, but healthcare should be the primary motive.
If this is the situation, across most of urban India as we speak, what's then, and I dread to think of what's really going on in India's towns and villages when it comes to infrastructure, when it comes to critical care, when it comes to support. What would you like to add, sir?
I think the lesson learned this time is that we need to train, we need to use technology. Training will not be implementable in near future. It will take long time, whereas technology will help us immediately. So we need to implement on technology. We have to implement on logistics. We have to implement on instrumentation. These three things are going to be very important if we have to face the third wave, because as they are saying about a third wave, which is going to affect the children, the country will go into depression. We need to use vaccination to vaccinate as many people as possible. Current government policies are not helping at all. So unless
Yeah.
we get the vaccination down to the last person living in this country, this continent, we will not win this
Yeah.
war very easily. We'll pay a heavy price.
Gentlemen, I have to slip into a short break. We're back though in just a moment. Welcome back with us here on Leaders of Tomorrow. And tonight, we're putting the spotlight on the healthcare system. have perhaps handled our vaccine policy different? Dr. Peters is talking about, if you can give Wi-Fi, for instance, free of cost, why not vaccine?
The government policy of 18 to 44, where the private individuals have to buy and vaccinate, is not working out because I can't buy it from Serum Institute. They're not giving. Bharat Biotech is not giving. They are giving in pieces.
We face the same challenge here, that since we have opened up the 18 plus vaccination on the first of this month, we haven't had access to vaccines at all. So we have virtually turned away any patient who wanted to come here and get vaccinated. In fact, even among those the 45 plus age group who got vaccinated and got their first dose with us, there is a substantial portion of people who are still waiting for the second dose, and we just don't have answers to these people. So the one thing that I wish the government did was, as Dr. Alok had rightly pointed out, if the government controlled the entire supply chain, if the government controlled the entire procurement of vaccines, and in turn provided them to the states, and if they involved private players, we would be very happy to be part of it. Or if they wanted to take over themselves, they could very well. Because just to give you an example, in Tamil Nadu, there are close to 6,000 primary health centers which have been which have taken up the responsibility of vaccinating people. And in Chennai alone, there are close to 600 such centers. And so the government penetration is quite high, and there is a primary health center every 2 kilometers. So I really wish the state took a more proactive role in taking over the vaccination program. And unfortunately, at this point of time, I also see one more challenge with this whole vaccination business. While, let's say, some players have access to vaccine, registering for a vaccine has become a nightmare, and almost close to impossible. Because when someone tries to go on the CoWIN portal and register for the vaccine, whenever we open up slots for vaccination, within a minute close to 1,000 slots are booked. And we
Yeah.
have very little control over, for instance, if we want to preferentially allocate vaccines for people who are yet to receive their second dose, or for the vulnerable group, we just can't. It's open to the 18 plus, and hence anyone can just take up the slot. And hence, until the government is able to fix some of these fundamental issues, I think it's going to be a challenge to vaccinate the 18 plus group. And as we have seen during the second wave, uh, close to 30 to 40% of the patients in our ICUs are in the age group of 18 to 45, which clearly indicates that patients who haven't had access to vaccine are the ones who are progressing in their disease and getting into ICUs.
Sure.
And, or maybe the other way to look at it, those who have taken both shots of vaccine, although they've contracted the virus, they haven't got sick enough, warranting ICU level care. So it's very important for us to get the vulnerable group vaccinated before the third wave, and to get the 18 plus group vaccinated before the third wave. And the only way the government can possibly do this is by opening up more production facility for these companies. Yesterday, I saw that one of the vaccine companies have taken over a ready-made plant in Pune, and that's a welcome move. And I'm sure there are multiple such facilities available across the country. I just really hope that the companies ramp up their production capability, which in turn
Sure.
will downstream help improve access to vaccines.
Once the pandemic is over, do we perhaps see more focus and impetus really coming on other diseases, which at this point, a lot of people are either hesitating to go to hospitals for non-COVID related, treatment, or there are no facilities really available for them. Is that something that we should be prepared for eventually?
At present, it was more of a conscious decision from our end to stop our elective clinical work and to only focus on COVID related work, because clearly that's our call of duty and need of the hour at this point of time. I'm sure once we open up post COVID, we will see a tsunami of regular clinical patients who haven't had access to care. And in fact, the people who suffer the most are immunocompromised, like patients who are oncology patients and post transplant patients, and and yeah, that's my take on it.
So I believe that, you know what, even in the last time when we saw in the mid of August, September, October, we are seeing more complicated surgical problems. So people are avoiding this as simple as gallbladder surgery. So they come up with empymas, they come with perforations, they come with CBD stones and obstructive jaundice. People avoiding their hernias, coming with obstructed hernias, strangulated hernias, and so forth. I am also primarily into bariatric surgery. People avoiding bariatric surgery are coming with more comorbidities, uncontrolled blood sugar levels, more of OSA related problems, and also getting COVID, for example, because obesity itself is one of the cofactors which causes COVID to be more severe in them. So yes, I'm sure that we are going to be seeing more of health related problems, and I'm sure we are going to be seeing more complicated surgical problems as we saw last time than when it opens up. I'm sure of that. Yes.
In this very incredibly difficult time, you were talking about how you waited on people without knowing or without being in a position to really do anything more for your own personal safety when it comes to protecting yourself against COVID. How are you ensuring the safety of your employees? How are you ensuring your personal safety at a time when you are at the front line?
So my message would be: number one, hang on tight, trust God. Second is take protection measures in terms of social distancing, wearing a good N95 mask. If required, wear a double mask. Don't just rely on a normal cotton mask. Let it not be something for an ornament, because you've seen, probably I've also seen people getting fancy masks with all those embroideries and everything. Use a good mask. Keep social distancing. Keep your washing your hands much very often. Educate people, educate yourself, educate your family members. Reach out to a professional advice and professional doctors as early as your oxygen saturation drops. Don't just become doctor yourself. Don't just take an SPO thing and see I am okay. Okay, so these are a few things that you can do, and of course, be courteous and be kind to the healthcare professionals who are working their life off for you guys. So that's my take home message.
We're talking about the third wave. We're talking about now the focus slowly coming back, perhaps, on other diseases. What's your message really for an entrepreneur who's in the healthcare space through this interview?
The most important thing is that we have gone through phase one and wave two, and I would like to tell them that prepare yourself. I don't think there'll be any lag between the second wave and the non-COVID patients coming in. People are not bothered about COVID. Forget, do you think they'll be bothered about not coming to the hospital because of non-COVID reasons? They'll all come in. Like last time, this year in March, February, March, we had a hospital full of non-COVIDs. And January was a full COVID. February and March became full non-COVID. This time it'll be even better. So non-COVID patients are just waiting. And as we are talking in the peak of wave, I've got 300 patients in one hospital, but I still have a cardiac surgery, knee replacement, other things are happening parallelly. People are still trickling in. So the fear which was there earlier is not there. So I would say be prepared, be ready. You're going to get a huge number of cases this year and time to come, at least for next 1.5 years.
Firstly, I understand that public health messaging, including heightened awareness of masking, maintaining social distancing, and sanitizing, I know it can get exhausting after a while, and they call it public health messaging fatigue. But it's very important that we don't let our guard down. Somewhere between the first and second wave, we as individuals are to be blamed as well for having let the guard down and having let the situation uh, come to where it is today. And hence it's absolutely important for every individual to to follow the COVID protocol that they've been following over the last year. I know it's exhausting, but I think my message for the entrepreneurs and people in the health tech space would be that there's a lot of misinformation and information asymmetry going around online about the things that you can do, cannot do. The one thing that has become quite evident is that we know how the COVID disease progression is per se, and the what I feel we have enough doctors to take care of patients. It's just that if we were to segregate them into thinkers and doers, and if we could apply technology, and while I agree with Dr. Alok that we haven't been able to linearly scale up our beds, when we do scale up our beds for the third wave, it would be very important for us to use technology. This becomes very important when the COVID hits tier 2, tier 3 cities, where we may not have access to the best of clinical facilities, best of clinical minds, and hence I think we will see a greater role for medical technology and remote patient monitoring as we progress
Sure.
from the second to third wave.
All right, doctors, gentlemen, thank you so much for your time. For those of you watching at home, if you have any questions for us, our contact details is coming up on your screens as we speak. Thanks so much for watching. Stay home, stay safe. Good night.